So think about walking into a hospital. Pretty much anywhere you look, someone's likely got an IV cannula. Right.
Yeah, absolutely. They're the real workhorses,
Mhm.
delivering fluids, medications, keeping a close eye on patients, especially the really sick ones.
Totally essential. But it's such a routine thing. We maybe forget it's not, completely risk-free. Our sources today really drive that home.
That's a really important point. These peripheral intravenous catheters, PVCs they're often called, they're vital. But yeah, they do create a direct line, essentially, into the bloodstream.
Hmm.
And that gets, well, particularly worrying when we're talking about patients whose immune systems are already compromised,
Right.
like people battling viral infections.
Right.
They're often much more susceptible to picking up secondary bacterial infection.
Exactly. And that really sets up the core question for this deep dive today. We've got some really interesting stuff here. Studies on bacterial colonization, the whole issue of antimicrobial resistance, or AMR,
Which is huge.
patent filings for a new kind of cannula introducer, even some pretty revealing videos showing how tricky IV insertion can actually be.
Yeah, those are eye-opening.
So the mission is this. Could something like a spring-loaded cannula introducer genuinely be a lifesaver? Specifically by cutting down the number of times you need to try and insert the needle, especially thinking about those infection risks and, well, the shadow of AMR.
It's a critical connection to explore because, like you said, getting that IV line in, it's not always simple. The sources show that things like, the patient's veins, the technique, it often means multiple tries.
Okay, so let's start with the infection risk itself.
Hmm.
I mean, IV lines are so common, it's easy to almost forget they're basically an open door for bacteria.
Precisely. You're breaking the skin's barrier. That gives microorganisms a chance to, well, get in and travel along the catheter. One study we looked at found complications in like roughly half of patients with PVCs.
Yeah, wow.
Yeah, sometimes needing them pulled out early. So it's a small tube, but the potential impact, pretty significant.
And while maybe a bloodstream infection from one single PVC is relatively rare
Per device, yeah.
per device, right? But when you think about just how many are used globally every single day,
Mm.
the total number of infections suddenly becomes, well, quite large. One source even suggested it could be similar to, or maybe even more than, infections from central lines.
Which are generally seen as the higher risk ones, yeah. And these PVC-related bloodstream infections, or BSIs, they're not just a minor hiccup you treat easily.
No, seems not. The research points to longer hospital stays,
Definitely.
higher mortality rates, unfortunately, and big costs for the healthcare system.
Huge costs. One study actually estimated the median cost for just one infection episode at around 5,600 euros.
Wow. Multiply that out.
Exactly. It adds up incredibly fast when you consider the sheer volume of IVs being used.
That's a massive economic hit, obviously. But the patient impact is the main thing, of course. And the trouble doesn't just start when you treat that initial infection, does it? Because treatment often means antibiotics. Lots of them.
And that's the crucial link to AMR. The more antibiotics we use, especially for infections linked to common procedures like putting in an IV,
Mm-hmm.
the more we encourage those antibiotic-resistant bacteria to develop and spread. It's sort of an evolutionary pressure cooker.
Which can make treatments fail down the line.
Exactly. Leading to higher costs again, longer stays, and tragically worse outcomes for patients. Increased mortality.
And this is where it becomes really, really critical for those patients we mentioned earlier, the ones fighting off a virus.
Right. Their bodies are already working overtime. Adding a secondary bacterial infection, especially one that shrugs off standard antibiotics,
Yeah.
that's a very dangerous situation.
It sounds incredibly serious.
It is. The sources on antimicrobial resistance, they paint a really stark picture. I mean, back in 2019, resistant bacteria were directly blamed for, 1.27 million deaths worldwide,
Directly.
and contributed to nearly 5 million deaths overall. It's this huge silent pandemic unfolding.
Okay, so the risks are clear. Infection, AMR, particularly dangerous for vulnerable patients. Now, let's dig into why getting that IV in successfully can be so tough sometimes. Those videos really showed it.
They really do. Finding a good vein, one that's, suitable, it can be surprisingly difficult, especially if the patient's veins are tricky because of chemo, or maybe they've had lots of IVs before, or they're just dehydrated.
You see them trying different tricks in the videos.
Yeah, like multiple tourniquets, warming the area, anything to make those veins pop up and easier to access.
It's not just finding the vein, is it? The actual insertion. There's a definite skill to it.
Oh, absolutely.
Our sources talk about common mistakes, like the angle of approach being wrong or not quite getting fully into the vein.
Or going straight through the back wall, the double stick.
Right. It sounds like even really experienced nurses or doctors can run into trouble.
Definitely. And there's a psychological element, too, which is interesting. One video mentioned cannula yips.
Huh, like in golf.
Sort of. Where failed attempts make you anxious, and that makes the next try even harder. It shows you need persistence, but also, know when to maybe get help.
And that statistic from one of the patent documents was quite striking that, on average, healthcare workers might use something like 3.3 cannulas per patient.
Yeah, 3.3. That really tells you multiple attempts aren't just occasional problems. They're pretty common.
Right. So IVs carry risk, especially for some patients, and getting them in often takes multiple tries. Which brings us nicely to this idea of a spring-loaded cannula introducer, like the Venaican example in the patent info. Let's explore that.
Okay, so the basic idea is to build in a spring mechanism. It's designed to help get successful vein entry, ideally on the first attempt.
Instead of just relying on pushing it in manually.
Exactly. It aims for a more controlled, maybe more precise insertion into the vein once you know you're in the right spot.
The potential benefits listed sounded pretty good. Less trauma for the patient, getting treatment started faster.
And crucially, potentially reducing that infection risk we've been talking about.
How does it actually work then, this spring thing?
Well, it seems to combine manual control initially. You still find the vein, insert the needle slightly, watch for that blood flashback to confirm you're in.
The visual confirmation.
Right. But then, instead of manually sliding the cannula off the needle and into the vein, you'd say, press a trigger. The spring mechanism then advances the cannula smoothly and quickly into position.
Ah, okay.
And a really important feature often included is automatic needle retraction. The needle pulls back into a safety housing right away.
Oh, that's huge for preventing needle stick injuries, too.
Absolutely. A major safety benefit for healthcare staff.
So how does cutting down the number of jabs directly lower the infection risk? Seems obvious, but let's spell it out.
It's pretty direct, yeah. Every time you puncture the skin, you create a potential entry point for bacteria. Simple as that. Makes sense. So, more punctures just means more opportunities for contamination. Plus, think about emergencies or high-pressure situations. One source mentions this maintaining perfect sterile technique gets harder when you're rushing to get access.
Yeah, I can imagine.
So, a device that boosts first-time success could really help minimize those risks just by reducing the number of attempts needed under pressure.
And it's maybe not just about the initial insertion contamination risk either, is it? Like, if it takes 4 tries to get an IV in, you might be tempted to leave that 4th one in longer, even if the insertion wasn't perfect, just because it was so hard to get.
That's a really good point. A smoother, successful first attempt might mean you're more likely to follow ideal dwell time guidelines.
Right, because getting another one in wouldn't seem so daunting.
Exactly. And we know from other sources, shorter time the catheter is in place generally equals lower infection risk.
So better initial placement could lead to shorter use overall in some tricky cases.
Potentially, yes. And it's worth mentioning the patent documents included comments from some medical professionals who seemed pretty positive about this kind of tech. They saw it as promising.
Okay, interesting. So let's really tie this all together now. The argument for cutting down insertion attempts, specifically thinking about AMR, antimicrobial resistance.
Right. So as we've said, every single attempt is a roll of the dice, essentially, for introducing bacteria. Multiple attempts just multiply that risk. And think about the stress factor, too, for the clinician, for the patient. When things aren't going well, it's easy for maybe sterile procedures to get slightly less rigorous, unintentionally, of course.
Yeah, the focus shifts to just getting the line in.
Exactly. Now, bring back those patients weakened by viruses. The last thing they need is a secondary bacterial infection, especially one that might resist common antibiotics.
That's the nightmare scenario.
Yeah, it really is. So in those cases, doing absolutely everything possible to minimize procedure-related infection risk is just paramount.
And that's where fewer attempts come in.
Precisely. If an innovation like a spring-loaded introducer can significantly cut down insertion attempts, cut down the potential for contamination, that could be a huge benefit in preventing those secondary infections.
And preventing infections means less need for antibiotics.
Which is the core of fighting AMR.
Yeah.
Every infection we stop before it starts is a win. It helps preserve the antibiotics we still have that work.
So wrapping up this deep dive then, we've looked at how vital IV cannulas are, but also the very real infection risks.
Risks amplified by the difficulty sometimes in just getting the IV placed, leading to multiple tries.
And we've explored how a spring-loaded introducer might offer a way to improve that first attempt success rate.
Connecting all of that to the huge global challenge of antimicrobial resistance, especially for people already vulnerable, like those with viral infections.
Yeah. So in conclusion, it seems like, while, okay, maybe we need more widespread use, more big clinical studies,
Sure, more data is always good.
the basic idea, the rationale, and that early positive feedback,
Yeah.
it does suggest that these devices, by potentially ensuring first-time success more often and cutting down attempts, they could be a really valuable tool.
A tool to help reduce those IV-related infections, which in turn helps in the bigger fight against AMR by reducing antibiotic use. It seems logical.
Definitely supports that critical need to prevent infections wherever we can. So maybe here's a final thought for you, our listener, to chew on. Given these potential upsides for patients, for staff safety, for tackling AMR, what do you think are the main hurdles stopping technologies like this from being adopted more widely in hospitals and clinics?
Good question. And what kind of evidence would really seal the deal, to prove their value definitively, maybe even as a potential lifesaver in certain situations?